The VA has listed the following cardiac conditions as falling within the definition of ischemic heart disease. This is a wide range. This is a big bucket. So if you're in here and you're diagnosed for one of these conditions, get your doctor to be as specific as possible. Again, always better to have him point to what this is. This is what you have. It's AKA ischemic heart disease. It's good for the VA rater to see that. And if he could create the nexus, of course, it's because you were, bathing in Agent Orange. Any idiot knows that. If he could write something like that down for the VA rater, again, that's going to help you. If the doctor says the condition does not count as ischemic heart disease, of course, the doctor needs to state that in writing and with medical rationale. If the doctor says that the condition does not count, a second opinion may be in order for several reasons. One of them is to get it service connected. So this is, since it has to do with the heart, and there's so many things in this bucket, you may go to a VA doctor or any doctor, whatever doctor, and they just might not see it the way that you see it. So getting a second opinion is a great idea. We're trying to get paid here, so you need the doctor to actually give you the right diagnosis. And if you have a doctor that's not on board, go get yourself another doctor, get a second opinion, get a third opinion. It's not that hard, just some doctors aren't going to see it the way you see it. That's fine. Moving on to the next doctor. How does the VA award disability ratings for ischemic heart disease? Once it's verified that the veteran has been exposed to Agent Orange, that's you, right? The veteran has a valid diagnosis of ischemic heart disease. We got to the right doctor. Took 2 or 3 of them, but we got the diagnosis now. The next step is to determine what the rating for ischemic heart disease is going to be. The proper rating is determined by looking at several factors per the VA schedule for ratings for the cardiovascular system, 38 CFR 4.104. Here's the rating criteria for ischemic heart disease. 100% rating. The veteran consistently experiences congestive heart failure, receives 3 METs or less, and he is short of breath, fatigued, and experiences chest pain, dizziness, and or fainting. Shows left ventricular dysfunction, and the percentage of blood pumped out with each heartbeat is less than 30%. A 60% rating. 2 or more episodes of congestive heart failure during the past year. A score of 4 or 5 METs, and he is short of breath, fatigued, and experiences chest pain, dizziness, and or fainting. Shows left ventricular dysfunction, and the percentage of blood pumped out with each heartbeat is between 30 and 50%. So as the ratings are higher, obviously there's more problems. So 100% is 3 METs. 60% is 4 or 5 METs, a 30% rating for ischemic heart disease, a score of 6 or 7 METs, and he is short of breath, fatigued, or experiences chest pain, dizziness, and or fainting. An X-ray or electrocardiogram shows evidence of hypertrophy or dilation. So it's a little bit different as you go down to the 30% rating. A 10% rating is given if a veteran has a score of 8, 9, or 10 METs, short of breath, fatigued, and experiences chest pain, dizziness, and or fainting, and requires continuous medication. So you have to figure out to get the 10, 30, 60, or 100% rating. If you're already rated for it, you should look at this criteria, and if your symptoms have changed and you deserve a higher rating, and you have that on paper and you have it logged, most likely, right? That most of these tests are objective. All these tests are objective. The doctor's opinion can vary, but objective tests, you either have it or you don't. So if you have a 10% rating for ischemic heart disease and you deserve a 100% rating or a 60% rating because things have gotten worse in the last 10 years, you should file for an increase. Check out my boot camp if you want to join me on a live session. If you need medical evidence, check out this email address right here. Email Second Strata, tell them what you need. You need help with a diagnosis, your symptoms, or a nexus. See if they can help you out with your medical evidence.